unvaccinated people don't have protection from if people out there are unvaccinated and they think I have protection from other people who are vaccinated, that's not true. You can still acquire it from somebody who's vaccinated. So if you're unvaccinated, you're very exposed at the moment. This isn't fear-mongering, this is fact.
So even though the vaccinated person may not get sick at all, the fact that they can, in their nose for a couple of days, if they've been exposed to it, carry this, shed a bit of virus, the unvaccinated person is terribly exposed.
They are exposed because there's been no change. We're talking about a variant now which is much more transmissible. There's no rationale why an unvaccinated person would be any less at risk than they were before. So I would urge anybody who's make your mind up, read the information. But my message to you is I would strongly advise you that for your own protection and for wider community protection.
Yeah. Now, there's been an intensification of effort to get people who are unvaccinated vaccinated with the presence of vaccination centres on campus. You can walk into a vaccination centre and get yourself a shot. How many people have since the big push went on a week or so ago? How many people have got vaccinated?
We see a big increase in people coming in, a doubling of people coming to those walk-in centres, certainly after a push. But if we look at that gap pattern two ways, one is as I said, 91% almost of the eligible population over 12 now fully vaccinated, which is a great figure. But rather than just talk about the 8%, focus on particular areas of risk. There's particularly groups from certain countries who have low uptake. Eastern Europe, for example, we had pregnant women, so we had a focused campaign on pregnant women. Then we looked at local electoral areas where there were a high instance of disease or low level of uptake. We were able to carry out that analysis. So we have focused campaigns in those areas, working with public health departments, working with GPs and working with pharmacists.
One of the groups that seems to be resistant to getting the vaccine are migrant workers who work in agriculture, picking fruit, vegetables and so on. I mean, is there a case for going to the employers of these? Because there's generally not, Farmer Jones down the road. It's generally some big outfit who are employing these on a seasonal basis and do it regularly, going to the place of work, setting up the little caboose and saying, come and get it.
And we have, and if you look at the vaccination programme has had to do, has had to be by necessity remarkably agile, because it couldn't depend initially on just setting up centres waiting for people to come. Working with our public health departments, they were able to say to us, these groups are not taking it up, or we're seeing outbreaks in these groups, in these meat plants. And precisely because of what you said, we then had to bring the vaccination programme to them, working with their employers. And the employers, it was an open door knocking on that door to say, come in, help us vaccinate our staff.
What impact has the imposition of the vaccine cert had on people wanting to be vaccinated? I mean, we heard a great report from Barry White the other day on the hard shoulder, where he was talking to a fella saying, well, my young fella wants to go to McDonald's now and I'm not being let in without my cert. That's why I'm queuing up for the vaccination. So it obviously has a touch, not the carrot but the stick.
Undoubtedly, yes. I'd like to think that the reason people have taken the vaccine up, there have been different reasons in different age groups. When we look where we began with this, Pat, the older age group, they had suffered so much during the lockdown and the cocooning and the isolation and the fear that went with the virus, which was justifiable, that perhaps acted as a major incentive. Other age groups, different motivations. Younger age groups, arguably, yes, the freedom it gave them in terms of being able to travel and being able to go into nightclubs or pubs or wherever else that required the cert. But I'd like to think that after that's a remarkable solidarity or mehel spirit that we had last year, that underlying all of this was some kind of community solidarity that we're reminding each other, not just ourselves.